Okay, so I had a patient ask, what are mini dental implants? What are your thoughts on them? How do they relate to All-on-4 and what you do? And specifically, do I do mini dental implants? So, I just showed you a picture of what I would call the most basic mini dental implant. What you'll notice there is that the implant is very narrow. So to define kind of what a mini dental implant is just like it sounds like. Mini means smaller, so there is less material, less volume. The implants, typically we're talking about the width or the diameter of the implant. And if you like numbers, we're talking about implants that are usually less than 3 millimeters wide. The normal implant, which I would call a two-piece implant, is something that has two parts. One part that goes in the bone and one part that goes above the bone, which is called an abutment. And so a two-piece standard implant is going to start around the size of 3.5 and will go upward of 6, even 7 millimeters wide. But the biggest difference between a mini implant and a standard implant is the definition. Mini implant means it's going to be a small diameter, and most of the time it's going to be all one piece, just like you see here. That the top, bouncing all over the place here. The top that is out of the mouth and what's in the bone, they're all connected to one piece, meaning you can't unscrew them. Okay, which is why it brings some challenges, and this is one of the reasons why I'm not a big fan of them. So, but to be complete, I have placed mini dental implants. I think I've only done a couple cases. It was early on in my career, and let me tell you the person that is a good candidate for mini implants. It's someone that plans on being in a snap-in denture for the rest of their life, does not have any plans of upgrading to something fixed like an All-on-4 bridge, or a fixed device that never comes out of the mouth, something that's screwed in permanently. Someone that has so little bone that, meaning that their bone width is less than 5 millimeters. The standard rule of thumb is that when you are looking at what implant size to put in, you're going to take the width of the bone and you're going to subtract 1 millimeter on each side, and that's going to be roughly the size of the implant. So let's say you have 7 millimeters of bone width-wise, and meaning like from the inside of your mouth out to your cheek or your lip. So let's say you have 7. So if you took a millimeter off each, so you take a millimeter for each side, that would leave you with 5 millimeters. So 1 millimeter for the outside, 1 millimeter for the inside. So subtract 2. Then you'd want an implant that's roughly around 5 millimeters. Okay, so that's why when you have less than 5 millimeters of bone, then you're going to be needing something that is more like a mini dental implant. But here's the problem with mini dental implants. Mini implants, they are because they're so narrow, they don't have a lot of volume, they don't have a lot of surface area, and so what happens is that these implants don't have the same lifespan as a regular implant. I gotta take a break here and show you my puppy. Billy, say hello. Can you say hi? This is Billy. He's our mascot at Dream Dental. He goes to work with me. He comes home with me. He is Dr. Hendrick's best buddy, and he's Daddy's boy, huh? He's my puppy? Yeah. Okay, that was a little commercial for Billy. But yeah, no, actually he comes with me here every day. He's like my little buddy. So, okay, so let's get back on topic here. Okay, so I was going to why I don't like mini implants. The biggest reason is there's not a lot of surface area, so they're not going to last as long. And that's one of the biggest things is, I think I've heard some people say 5 to 7 years. Either way, that because there's not a lot of surface area, many patients, not all, but many patients will lose bone, and the implant won't last forever. Okay. Now, in fairness, I haven't placed thousands of mini implants to say from experience. This is what I read, this is what I talk when I talk to people, but I'm not going to say I know everything about them, and I have so much personal experience. But here's the other reason I do not like mini implants, unless there are very special circumstances. But the reason why is because they're all one piece. That means that you're limited to one treatment, meaning that mini implants are great for dentures, for snap-in dentures, but you can't transition down the road into something that is fixed in place, like a bridge. So what that means is that if you ever want to upgrade to something better, like an all-on-4 bridge, what that means is that you're going to have those implants literally cut out and replaced with a two-piece standard implant. And so let me give you, this is like, that's a two-piece standard implant there. I'm just doing some free advertising for people here. And you see how there's a piece that goes out of the mouth, piece that goes in the mouth. All I Googled was mini dental implants, and this is kind of what came up, right? This is what's here. So mini dental implants typically are going to have that connection that you see there, where it can be a ball connection, which I actually really like, or you can have a connection that is more, let's see if I can find one here. So that's another example of a ball connection, but see how it's all one piece? Let's find, there's another one here with a kind of a ball connection. But there's a locator system also that's up. I guess their marketing maybe not as great, but the one that if I had to use one, it's called a Locator mini implant. And the reason I like it is because it does come in two pieces. It's not like a regular standard implant that you can actually change and use for different purposes. The only thing you can change out is the head that basically gives the height. And it is actually, so you have a little bit of control, but you can't use it for crown and bridge implants. You can't use it for a single implant. You can't use it for all-on-4 or something like that. It's strictly just the top portion has like a little thing you can spin on and off to basically control how much of that is going to poke up out of the tissue. So, okay, but that's a good example there. See how it says mini dental implant traditional? See the width difference? That's a big difference, right? You're looking at like a sixth, maybe even in some cases a tenth of the amount of surface area, and that really is a big difference. So just around the wagon one more time here. I want to show you one other thing here. There are some people like this right here. You see all those implants in there? First of all, that is nuts. I think that's ridiculous for anyone to do that. But some doctors are beginning to use these mini implants for crown and bridge, is what you see there. And that's what happens is it just can't support the weight. It can't support the physics doesn't work out well, and you end up having lots of bone loss, and that's what you see. There's lots of threads exposed. And so you definitely don't want to be pushing the limits, I believe. And I haven't, I feel like I read a lot about implants and stuff, and I still think that doctors should stay on the safe side on what has been clinically proven to work long term. But at the end of the day, there is a good reason to use mini dental implants. Again, it's someone that has very little bone in a cross section. Usually it's going to be less than 5 millimeters of bone. and it's going to be someone that has no expectation, meaning they don't have any plans of wanting to upgrade. Because if, let's say you only had 5 millimeters of bone, but you really, like, say you're in your 20s, 30s, or 40s, and you're like, you know what, I'm gonna get a new job, and I really want to be able to upgrade in the future. There's other things you can do. You can do bone grafting. You can augment the bone. You can do what's called a ridge split. There's other things you can do to be able to make it so that the site can have a full implant. You can do zygoma implants. I mean, there's lots of things. And so don't just go to a mini dental implant just because you've heard you don't have enough bone, okay? The biggest reason not to get a mini dental implant is because of the cost. And that's where I feel like we need to do better at educating our patients. And that's the worst reason is to do it because of finances, because it's a short-term fix. Remember, it's going to limit you to that you could only use a denture. You can't leverage that in the future. It's only going to last, 5 to 10 years, if that. And then, again, at the end of the day, like I said, if mini dental implants are cheaper, and I think that a lot of doctors like the idea. The surgery is a lot more simple. At least in theory, it's supposed to be, but it really isn't. But some doctors will go to a weekend course, and then all of a sudden they start placing mini dental implants, and it can be a nightmare. And I feel bad. I've had a lot of patients. Well, not a lot, but I've had a fair number of patients, at least a dozen patients over the past years, that had mini implants placed, and then they wanted to upgrade, and literally I cut them out, and I had to take them out and then place a standard implant that could support a fixed or permanent bridge. So again, you want to look long term, get clear about what you want. If you're a doctor out there, I don't think it's right to suggest mini implants on someone that has tons of bone. I just don't think that if they knew the consequences, because the elephant in the room is that most patients, they're assuming that what you're doing in their mouth is going to last forever. And if that's the case, we need to be better at communicating with patients, and maybe they wouldn't choose treatments such as mini implants. So I hope this has been really helpful. If you have questions, please comment below, and I will try to answer more and more YouTube questions as they come up. And I'm grateful for all of you guys out there, and hope to see you in my office one day, or see you on one of my live videos. Thanks.